One common topic of conversation in clinic is, do I have an infection? Do I have a pathogen? Do I have a parasite, a virus, a bacteria that is keeping me unwell, that is causing autoimmune disease or my state of chronic inflammation? And the answer is maybe, but if the immune system is struggling with that particular pathogen or a number of pathogens, why is that? You always have to think, regulate the immune system first. Don't go after a pathogen until you feel that you have sufficient foundations in place to maximize and support your immune system and your immune response the best that you can. Just like with antibiotics, we rely on a well-functioning immune system, or functioning as well as it can do, to do the job. And there is so much information out there and so much conflicting approaches, even amongst us practitioners, that it becomes really overwhelming and confusing for the public to know what's the best approach for me. In my clinical experience, I rarely will go after a particular pathogen, whether it be a Candida or a parasite or a virus. I don't say that I never do this. I do not start there. I start by making sure that I am identifying as many factors or triggers that may be hindering my client's immune system from working properly, whether that be looking at their nutrient status, optimizing their protein intake, balancing their blood sugar, looking at their vitamin D, at their iron stores, their omega-3s, of course, whether it be at looking at their lifestyle and looking at their stress load and how well they cope with stress and how much they feel that they are impacted by their stress. And then it's again conversation around what can we change? How can we support you through this period of stress? What can we do in the short term and the long term? Whether it be looking at, so many factors, looking at their sleep, looking at their movement. Do they get outside at some point in the day? What about their support system? What about the connection? But also the environment, a daily conversation is around mold. Are you being exposed to mold? Have you been exposed to mold recently or in the past? Is it having an impact on you today still? Mold affect people in different ways. Mold is really common and it doesn't affect two people in the same way. So you could have a family of 4 and 2 people are poorly because of the mold exposure and they have different symptoms and the other 2 family members are absolutely fine. So you can create a little bit of, I suppose, difficulties for loved ones around the individual to really understand how they could be suffering from living where they live because others are not. But you need to ask those questions. Even with testing, do I have Lyme disease? Do I have Bartonella? Do I have other infections? If you're testing whilst the immune system is really dysregulated, you're unlikely going to be getting accurate test results. Testing for some infections can also be very difficult. So sometimes you have to go by symptoms, but symptoms can cross over amongst different inflammatory response and conditions. So before you go down the route of narrowing down what you may be wanting to go after in terms of pathogen, make sure that your immune system is in the best possible place to deal with what it needs to be dealing with. And you may find that actually, when your immune system is more regulated, you'll find that you're feeling naturally more resilient. So some people will find that they don't get ill as often. They don't get what they felt was an ABV reactivation every few weeks or a few times a year. They don't get colds and flus as much as they used to. Their immune system is dealing better with what it's having to manage internally, but also what's coming its way from the outside, from coming across other individuals. So if there is really one piece of advice for anybody with chronic inflammation, whether it be even autoimmune disease or whether it be CIRS, whether it be what they think to be mold illness, whether it be just chronic inflammatory symptoms, no clear explanations, no idea as to why that would be, is make sure that you have all the foundations in place. Some things are easy wins, easily corrected, and others it's just, you know, it can be a bit more of a process to get things in place. And this is where working with a practitioner can be really invaluable to, you know, take a bit of a shortcut and help you analyze and understand somebody who looks at the full picture without that bias, who, you know, and they can tell you, I think that you need to start here. I think that those are your starting steps. And then let's see what readjust, what autocorrect, what are we dealt with, and then let's dig deeper. That would be one very, very important piece of advice that I would give anybody who is suffering.